Calling this little blurb the perfect curve. I have a friend who went to a seminar with somebody who's very famous within the chiropractic community, understands biomechanics very well. He's an expert in soft tissue. I won't mention his name, but they were discussing. My friend was discussing with him the importance of putting the curve back. And this gentleman, who's supposedly one of the best in the country, in the world, with soft tissue, said the jury's still out on that. And he and I were discussing how sad that is, that if one of the best guys can't figure out why we need to have a curve in the neck and mid-back and lower back, then who can? Frankly, the information is out there. We need to have that curve system because biomechanically that's how it works. We need to have that curve system because it takes all the pressure off the spinal cord. We need that curve system because that is how the biomechanics function. So there are many different reasons why. Also, symmetry of afferent inputs to the brain, it turns the brain on. So the better the biomechanical system, the better the turning on of the brain is, and the more symmetrical that brain becomes, and all that. And all of that is already verified through research. But the thing that I want to discuss is that the reason why they don't understand is they're looking for a number. And we're not looking for a number. We're looking for a circumstance that best represents the best biomechanical system versus gravity. And it really deals with that force, gravity. So if we want to have a best way to analyze a patient, the number one most important factor is their weight bearing. That is number one. Number two, we're dealing with other issues, and then number three is the curve system. Particularly, we're gonna deal with any instability, particularly like between C1 and the skull. We call it C0. All of that's very important to understand. But the curve system itself will be modeled according to the need. As we get that head more and more over the center of the body, we create a need for it to be a curved system, and that will happen. But how do we make, and this is how I always say it, how do we make a perfect curve besides my wife? It's all geometry, okay? First of all, we get the head over the center of the body. But if you want a perfect curve, the curve geometrically is going to be determined by the length of the structure, whether it's a neck or a mid-back or lower back. It's going to be dictated by the length of the structure. The strongest curve, that curve is a part of a circle or an orb, and if we create, okay, this is radius, and then geometrically we've got the chord of the curve. The strongest curve is where the chord is equal to the radius. So we say, how do we make the strongest curve possible? The answer is we don't. The answer is we create a biomechanical environment to where the patient has to create that curve system. That's how we do it. And it's their curve. So I don't know if it's going to be 45 or 43, and frankly I don't care. It's where every vertebra is contributing to that curve, every disc is contributing to that curve, so that not one area is getting beat up more than the other. If you got too much curve in one area and too little in another, it's like a husband and wife relationship where the wife's doing everything and the husband's doing nothing. And she's getting burnt out and angry, and he's wondering why his wife's pissed off. Until there's a special meeting that happens, and then all of a sudden he's helpful all of a sudden. Well, we're here to make that meeting happen, to make every vertebra and every disc contribute to that curve. But we have to do it by getting the head over the center of the body so that the weight of the head is going through the center of the body itself and forcing those structures and forcing the brain to create that curve so that one area doesn't get beat up more than another.